So we've been essentially full or near capacity for a month or two right now, which means if we have a new COVID patient come in, we have nowhere to put them until we discharge a different patient, and that's pretty much across all of our hospitals. And it's really most significant in our sickest patients. So ICU beds are the tightest crunch, followed by our medical floor, where COVID type of patients generally are cared for. And so once we discharge a patient, there's usually 2 or 3 patients at other facilities or in emergency departments that we're trying to prioritize to see which one of those is the sickest that needs to come into the hospital first. And at other times, we'll be taking patients that are getting better and we'll transfer them to a different hospital so we can get the sicker patient into, say, that ICU bed. And so we're doing a lot of trying to level out the load across all of our hospitals across the state and across the system as best we can to care for everybody just as quickly and in the best and the most appropriate place that we can. The bottom line is we learned last year that we can surge up quite a bit. We're at about half the number of COVID patients in house that we were at last November of 20. Now, at that time, when we were sitting at a high number of COVID patients, we had almost nothing else in the hospital. This year, we're seeing influenza cases start to rise, and so that adds into the mix. And there's only so long length of time that you can't do a lot of these other types of procedures. People need their heart bypasses. People need their cancer surgeries to remove their cancer. You just can't keep putting those things off like we did, initially when we thought this was going to be a 1 or 2 month thing. We could push things off a little bit. Now that we're going into 2 years, you just can't keep pushing those things back. And so in the short term, we can surge up a little bit further than we are now, but you just can't. That's not sustainable. It's not sustainable for the staff. It's not sustainable for supplies. And so in the short term is a little bit different than what we can do in the long term. One thing we definitely know about COVID, if you're sick enough to get in the ICU, one, you've got probably a greater than 50% chance that you're going to die. But if you are going to survive, it's going to take literally weeks, and you're going to be in that ICU bed for a long time. And so they don't open up very frequently. And so, yeah, it's a real struggle right now to be able, especially on those more critically ill patients. I think we'll learn a lot more here in the next couple of weeks as we see what is the hospitalization rate going to be, how quickly are those hospital cases going to go up. And the hopeful news is that as quick as this is coming on, it may not last, months and months. This may be, we may see a terrible January and early February, and things may start getting better. So we just need to hold on.